This program is sponsored in part by the National Catholic Society of Foresters. Hello again and welcome to Looking at Social Justice. I'm Jim Grant, the Director of Social Justice Ministry for the Diocese of Fresno, which includes 8 counties. And we never mention them, but since we're going to be talking today about one county, let's talk about the whole diocese. In the south, we've got Kern Inyo. In the middle, we've got Kings Tulare. In the a little bit northern part, we've got Fresno Madera. And in the northernmost part, we've got Mariposa, Merced counties, 8 counties. Where we have a lot of work going on is in a group called Faith in the Valley, which is helping us in many of those counties. We have done some programs in the past with those that work in Fresno County, but today our guest is Lupe Delgado, who happens to be the organizer for Faith in the Valley, working out of Merced. Lupe has been working at this type of work for about 13 years, doing things like CalFresh, public benefit programs, both state and local, Healthy Families, Medi-Cal, Covered California, CalFresh, SNAP Ed. These are programs that right now lead her into the work she's doing with health care up in Merced County. Lupe, you come from South Central LA, but now you're way located in Merced, out of Atwater where you live, out of the parish of St. Joseph's up there, or St. Anthony's?
St. Anthony's.
Tell us what it is that makes the county and Atwater so important to you and why it's your home for these last 10 years.
Great, that is a great question. So yes, originally I come from LA. I've been here in the Central Valley. Atwater is my new home for the past 13 years. And the moment that I arrived to Merced County, overall, I realized that there was a lot of issues that are priorities for community residents. You know, coming from a big city such as LA, there's a lot of issues there too. However, at the same time, there's additional or more benefits or services that community residents can have access to. And so with that, I became very involved in understanding a very diverse community, right? And so one thing led to another. I started pushing, and my interest was education. At the time, my kids were young, and they were in their early years of school, right? And so it was really important for me as a parent to be engaged in their education. So I've always told my kids that I am the #1 intervention. So they're adults now, and throughout the school year, I was very involved. I was a member of the school site council member for the whole 9 years. And then after that, eventually they graduated from high school, and currently they are attending, all 3 of my kids are attending higher education.
Such as you also did at Merced College and CSU Stanislaus.
That is correct. The challenge was put back on me by my own kids, right? It's like, here you are, proactive in education. What about you? So it was a moment of reflection for me to realize if I'm talking the talk, then I gotta walk the talk, right? So as you indicated, I am a student myself. I am a junior, and my major is sociology.
Now, tell us how you ever got connected to Faith in the Valley and your, let's say, role in what's getting done up in Merced County.
Great. So with Faith in the Valley, you know, I came on board about a year ago. However, the experience that I've had has been a long range of about 13 years. Faith in the Valley, I do want to say it's a congregation that really works with about 120 different congregations, and we represent about over 100 people in Fresno, Kern, Merced, San Joaquin, and Stanislaus. And so there was an opportunity as a community organizer that really pulled me and continued to put me into healthcare access. So for the past 4 years, I've been, or beyond 4 years, I want to say about 13 years, I've been very involved in really understanding the whole concept of healthcare services or access, right? And I have a number of years enrolling people into the Medi-Cal program. Never have been an eligibility worker, but I have a system in the application process. I'm very knowledgeable with that, as well as other state or federal programs. And so I think that expansion really took place after the Affordable Care Act. And so Faith in the Valley had an opportunity, and I think it was my time to be there and to really be very impactful and continue to work for community residents in Merced.
I'm looking here on the sheet you prepared, which is really helpful because it helped me see the breadth of work and the depth of work that has to get done up in Merced County. In the vision statement of Faith in the Valley, it mentions 6 big priorities. So I'll just list them, but then you can decide where you want to open them up and tell us the ones that are important for you. Good jobs is something that Faith in the Valley is about. Clean air is also a big priority. A third one would be clean water. So the environment is very important to Faith in the Valley. Alternatives to incarceration, this whole idea of mass incarceration, that is a commitment against that by Faith in the Valley. Quality health care, and finally, safe neighborhoods. So with those 6 major possibilities of commitment of Faith in the Valley, tell us how you focused on health care, which really became your bag, right? That's what you are committed to.
That is correct. So Faith in the Valley did identify, we call them pillars, so 5 pillars. One of them also has to do with immigration, right? A lot of these visions that Faith in the Valley has are intersectable. So one of the things is that I'm going to go ahead and focus on a local campaign, which is the Health for All. So the local campaign is pretty much, it's not really only being led by Faith in the Valley, it's a coalition of other partners. This coalition is pretty much funded by the California Endowment, and it's a number of nonprofit organizations as well as faith-based organizations and even some that work within the school systems that really came together as a coalition. And our vision, we're known as the Prevention Action Team. So I will refer to the Prevention Action Team as the PAT team. What we're doing is that we believe that everybody in Merced County should have access to health care services regardless of immigration status. That is our vision as a coalition. And so, our undocumented families overall, are seen. However, even though they're seen, we know they're here, we see them, they do not have the same type of privilege or services. They don't benefit from many of the services. People think that they do, but they don't. There's a lot of restriction because of their immigration status. And so I do want to say that has been a huge passion for me, making sure that everybody will have access to health care because it is a human right. And so that is one of the biggest push that we're doing. That's a very active campaign that is currently happening in Atwater. I do want to say also that, one of the things is that we want to also lift up that our undocumented population contribute to the economy. And many times they contribute to programs that they don't benefit from, right?
You said it's here $2 billion, which is no small sum, and that would be up in Merced County.
That is correct.
So you must be so committed that the money that people are already expending in taxes and in the things that they do, that some of it should come back, but it's not.
Correct. So that is a current funding that came out, that they contribute over $2 billion only within the Central Valley, specifically, right? And that is in taxation. So taxation can be, home property. It can be them purchasing something at the grocery stores and so forth. And so they do contribute to the economy. And one of the other things is that the healthier our community residents are, the more economic stability our community is. And so, one of the other things that we, doing this campaign for about 4 years and so, we did a polling, which it was really important for us to really hear from our voters, right? Specifically in Merced County. So there was a polling that was conducted by FM3, and they realized, what came out of that was that these were numbers from registered voters that vote in Merced County. 56% of Merced County voters expressed that they support for the expansion of health care coverage to all in Merced County as a whole, regardless of immigration status.
Were you, as I might be, surprised at a majority of people think people are getting shortchanged?
I was not surprised because it is a human need. We all get sick. We are beyond boundaries. I don't think that status needs to determine who is eligible or not. And so it wasn't surprised. It just says that the priorities maybe for people in position might not see it that way, and that is one of the ways we continue to advocate and lift up, these statistics and numbers.
And then what about the other statistic that it also corroborates the idea of people have a sense that it's not equitable, that second figure?
Yes. So one of the things is that in addition to that, we found out in this polling that 58% of Merced County residents voters believe it is the county's responsibility to allocate some funds. Now, the reason I bring this up is that, anytime any specific program is in the creativity stage, if it's going to be coming depending from where government funding, state, local, federal, there's always going to be the question, where is the money? And I think that it is up to our people to identify priorities. What is priorities? And what we're talking about people's lives. We're talking about providing people the opportunity to live longer and healthier, to be productive, to be part of the economic growth, right? With that said, just in Merced County, over 51% of community residents fall under Medi-Cal, which means they live under the federal poverty level. And so that is a big number also. And so it's just really trying to speak to the people that are in positions that make this decisions to see that it's beyond a status, but it's more of overall community residents.
It says here that there's a distinction between who might benefit from the Medi-Cal coverage. Certain groups, but then others not. Can you help us figure out how that is and why that is?
Sure. So Medi-Cal overall, on a federal level, it's known as Medicaid. Medi-Cal here in California, it's what we know our public service for healthcare services is Medi-Cal. So what happens is that they put restrictions. So the restriction in this case is that one of the requirements in order to be eligible for full scope Medi-Cal, you have to have a legal status, meaning either you are a U.S. citizen or you have your legal residence permanent card, or you might be here with a visa or so forth. There has to be some sort of a legal status. And that is a factor that determines eligibility. So for people that don't have immigration status, then they are not offered full scope. They can still apply for Medi-Cal. The difference is that they would be eligible for restricted services, which is more of limited type of services.
What about the idea that undocumented children and youth might be covered, but then the adults are not if they're undocumented?
That is correct. So in May of 2016, children under the ages of 19 now for the first time, regardless of immigration status, are eligible for full scope Medi-Cal. So that was a big victory. That was something that passed, like I said, and was implemented as of May 1st of 2016. So California leaders as a whole realized the priorities of keeping our youth healthy. And it became, like I said, effective as of May 16. The problem is that we still need to continue to advocate for our adults, right? Because adults are also part of the motor that sustain our economic growth and so forth. And so, you know, once again, it's to really provide everybody and, you know, just take the restriction, citizenship requirement out, you know, or find local solutions like other counties have found. Which is going to lead me into realizing that out of 58 counties in California, Merced continues to be 1 out of 10 that do not provide a safety net program for the remaining uninsured.
So what's sad about that is in our diocese, the other county that's like Merced would be Tulare County. So the two of you, Tulare and Merced, are just not benefited the way that 48 other counties are.
That is correct.
Why is that?
Well, I cannot speak on why Tulare County might not be, and there's other counties here, which is about 10, that do not provide a safety net for the remaining uninsured, specifically because of their immigration status. But what I can highlight is the work that in Merced.
Oh, yeah.
Again, the thing is, what is a priority for our community, right? Is it people's lives, or is it investing that money in other programs that might not be, you know, it's as they don't see, you know, and I think it's hard to say why, but it's not a priority. But what we're saying is it is a priority.
Oh,
it's people getting sick. It's people that contribute to the economy, and healthcare is essential for everyone.
On these notes that you've handed to me, you have a real good list of sad statistics, problems. What are some of them that you know you're working around, that you know that that's the situation, it's a problem, we're working on it? So what would be some of those problems, Lupe?
So, you know, again, and I'm highlighting the same thing over and over again. Merced County is a community that over 51% of community residents fall under the federal poverty level. So that's huge. So we're talking about a very low-income community. In addition to that, the numbers, 23 to 27,000 people continue to be uninsured. And why is that? And even after the Affordable Care Act that expanded services to adults, you know, of course, immigration status was one of those requirements also, whether you were applying for the public service, such as Medi-Cal, or private through Cover California. That's a huge number. 23 to 27,000 people in Merced County continue to have not have access to healthcare services. So they are considered either underinsured or uninsured. And out of those uninsured, we roughly estimate about 9,000 or more that are identified as undocumented individuals or adults, because children can now benefit from Medi-Cal services if they fall within the required guidelines.
And then this low-income residents that you're talking about, what they do is not only have no access to preventive care, but it complicates the whole system because the efforts to take care of them are also impacting the less return for those that are being covered. It implicates everybody in this low commitment to health care.
Yes, and that is correct. You know, one of the things is that I have so many stories that I have collected throughout the years. Stories on, you know, their pain or how they're hurting, how they haven't sought services from a doctor or been to a clinic, and it's because they don't have health insurance. So what happens is that they don't go and seek preventative care services. And we know that preventative care services would be more cost effective if they were seen at an early stage versus them seeing and seeking services at the emergency. So one of the things is that many of these individuals, they wait until they're having a severe or chronic catastrophic type of illness, and then they end up at the emergency. So when they end up at the emergency, then the cost for an emergency visit is within the thousands. And then not only that, most importantly, they are being seen and checked out with already severe, chronic, or catastrophic type of illnesses.
We've been looking at this list that we'll continue working with, but it's sort of like cold figures, numbers, realities that are in the thousands of people, in the 58% of people. Would you want to share with us, even if it's one example of a person or a family or a situation of the many that you've worked with over these years that might let our listeners and our viewers get an understanding of the implications for this particular situation that you've dealt with, Lupe? What would be one example you might like to share?
Absolutely. You know, and the first one that came up was one that was shared most recently. So most recently, we have a lot of community residents that we call them leaders. So Faith in the Valley, we built our leaders, our community residents, to be leaders by them lifting up their stories, sharing their stories, being part of the conversations, being at the table with elected officials or people in positions, right? So that we can together begin to change policy. And so one of our community, our leaders, she's been advocating for health care for all. She is someone that is impacted because of her status, and she lifted up her story. And I have heard her story many times, but this time it was different because this time it was her now going through some severe health issues. So even as a leader, her advocating for the past 4 years, been at the table talking to our elected officials on really finding a solution for Merced County residents overall. I received a phone call one day and she said, "Can I come and see you?" And I said, "Absolutely." So she came and she shared with me her situation. So along with that, we went ahead and did whatever we were able to do in providing her whatever she needed at the moment. With that, she ended up within a week in the hospital because she was experiencing some pain. Well, little did she know that as she went and went through the emergency process, that she's been here for 20 plus years, and she shared with us that she does not have a PCP, which is a physician, right? A physician, a doctor that cares for her. And so when she went to the emergency, you know, again, through the process and doing the registration forms and all that, because of her not having insurance, they were going to send her home. And she says, no, I don't feel good. Please, I need help. So they did take her in. They took her in and she was seen, and she had a tumor. And so immediately on that day, she was transferred to the hospital, and within hours, she was in surgery. I do want to share that she's doing fairly well. She's recuperated, and she's gotten better. But this is just one of the many stories and on type of stories that our community residents share with us. I think it's really important, again, as mentioned, is that if we continue to seek, our solution as a prevention action team is to find a solution. One of the solutions that, based on community needs that we heard, preventative care services, also known as ancillary care services. So it was really important for us to pull in. This campaign is pretty much led by community leaders, right? So they're leading this campaign, and what we heard back was ancillary care services is key. And so our push, and as well as community residents, is that we want to continue to highlight the importance of having everybody healthy, but also we need to find a solution, and a solution for Merced County ancillary care services would be ideal. I do want to share that last year, the prevention action team, along with community residents, took this up to the board of Merced County Board of Supervisors for vote, right? Because as we saw earlier, more than 58% of community residents of that vote said it is the county's responsibility to allocate funds. So we took it to the county for a vote, and the vote was 3-2 against. So that put us back to going back, to figure out how we're going to continue to move forward. And what I do want to say is that we continue to be moving forward with this campaign. We want to make sure that the county sees that this is a #1 priority for Merced County. After that 3-2 vote, we took it back and we continue to listen to communities, and they continue to vocalize that health care continues to be the #1 priority for Merced County.
I want to say that it is important to know that this is happening in Catholic parishes. Lupe is involved with Sacred Heart Church in Merced, with St. Anthony Church in Atwater, which is hers. That in 2019, the hope is to be connecting with Sacred Heart in Planada with Monsignor Ginelli. We only have about 15 seconds left. I want to thank you, Lupe, for what you introduced us to over this project of Faith in Merced. Thank you for sharing what Faith in the Valley is doing up in Merced County. We applaud your work, and we want to give you a chance to share it. Thank you, and God bless.
Thank you, Jim.